Okay, let's picture this. A high-stakes biological battle. It's happening inside our own bodies, where the very medicine designed to heal us suddenly turns into an enemy. We're diving deep into toxicology, the science of poisons, and what happens when the body is truly under attack. And it all boils down to one critical question. This is the real razor's edge of medicine. The line between a dose that helps and a dose that harms can be incredibly, unbelievably thin. So what happens when we cross that line? How does the body even begin to react? And more importantly, how do we fight back? Let's get into it. So first things first, we need to understand the enemy. Drug toxicity isn't just about taking way too much of something all at once. Nope, it's way more complex than that. It's this intricate dance between the substance, the dose, and time. How a drug behaves in the body is really what dictates the kind of damage it's going to do.
And this is where it gets interesting, because there are different kinds of attacks. You've got acute toxicity. That's the sudden, overwhelming assault happening in less than a day. Then there's chronic toxicity, which is more like a slow, grinding siege on our organs over a long time. Carcinogenesis? That's when a substance messes with our DNA or our immune system, basically turning our own cells against us. And of course, some drugs can cause just devastating harm to reproduction.
Yeah, and that reproductive harm is a really complex battlefield. A drug can attack a developing fetus directly, right? Like a guided missile crossing the placental barrier. But it can also launch an indirect attack by changing the mother's body, say by constricting blood vessels that supply the uterus or throwing her hormones completely out of whack. It's a true two-pronged threat. Okay, so we know the enemy has different strategies. But how does it get in? I mean, how does the invasion actually happen? Understanding the route of entry is absolutely critical if you want to mount an effective defense and, actually treat the patient. And these invasions can happen in so many ways. It could be completely accidental, like a curious kid getting into the medicine cabinet. It can be deliberate, sadly, or it can be something in our environment, like exposure to chemicals where we work or live. And each of these scenarios, well, they bring their own unique set of challenges for figuring out what's wrong and how to fix it. And these are the main gateways into the body. Most often, a poison is swallowed, but the route of entry completely changes the game. If you breathe something in, it goes straight from your lungs into your bloodstream, triggering a super fast body-wide response. Getting it on your skin might be slower, kind of like a more sneaky, insidious poisoning. And intravenous? Well, that's the most direct and fastest route there is. The route really determines how fast the poison hits and where the damage is going to start. All right, the invasion has happened. The body's alarm bells are screaming. So what's the first move in the emergency room? Well, you might be surprised to hear it. It's not the poison. It's the patient. The number one priority is stabilizing them, keeping them alive while that internal battle is still raging. And to do that, medical teams live by the ABCs. It's fundamental. First up, A, for airway. Can the patient actually get air in? Is anything blocking the way? Second, B, for breathing. Are their lungs working properly? Are they getting enough oxygen? If not, you get them oxygen, fast. And third, C, for circulation. Is the heart pumping effectively? Are they in shock? If so, you get fluids into them right away. Only when the ABCs are stable can the team even think about tackling the poison itself. Okay, the patient is stable. Now the focus shifts. It's time to go after the invader directly. The new mission is decontamination. We've got to stop any more poison from getting absorbed and help the body start clearing out what's already inside. And they have a whole toolkit for this. Now, you might be thinking of things like stomach pumping or gastric lavage, as it's called. But honestly, that's not used very often anymore. It carries some serious risks, like damaging the esophagus. Same goes for making someone vomit. The choice of tool really depends on the specific poison, how long ago it was taken, and the patient's overall condition. One of the biggest players in this fight is activated charcoal. Seriously, think of it as a biological super sponge. It's made from vegetable matter, and its structure is full of these tiny pores that create a massive surface area. This lets it literally grab onto and bind with many toxins, inactivating them. But it's not a silver bullet. It has its limits. It doesn't work on stuff like iron or lithium, basically because those tiny inorganic ions are just too small and don't stick well to its carbon surface. So it's a powerful tool, but a specific one. And now we get to the climax of the story. The patient is stable, decontamination is happening. Now it's time to deploy the most advanced weapons in the arsenal, antidotes. And these aren't just general-purpose remedies. They are highly specific, targeted counterattacks designed at a molecular level. And just look at how specific these are. If you have a paracetamol or acetaminophen overdose, the antidote is something called N-acetylcysteine. For an opioid overdose, it's naloxone. For the blood thinner warfarin, you use vitamin K. Each one has a completely unique way of working, tailored perfectly to counteract its specific poison. Let's look at how they do it. So the first strategy is basically just neutralization. The antidote goes in, finds the poison, and physically latches onto it. They form a new, harmless partnership that the body can then just get rid of. A classic example is desferrioxamine for iron poisoning. It literally acts like a claw, grabbing onto the free iron ions and stopping them from wreaking havoc on our cells. Simple and very effective. The second strategy is all about good old-fashioned competition. See, our cells have these little docking stations called receptors. Think of them like parking spots. Poisons work by taking up those spots, while antidotes like naloxone are just better competitors. They swoop in and literally steal the parking spot right out from under the opioids, kicking them out and immediately blocking their dangerous effects.
And the third strategy might be the coolest of all. It's about boosting the body's own defense systems. During a paracetamol overdose, the liver's master detoxifier, a substance called glutathione, gets totally depleted trying to fight the poison. So the antidote, N-acetylcysteine, doesn't even touch the poison directly. Instead, it helps the liver rebuild its glutathione supply, basically rearming the body so it can finish the fight on its own terms. It's a brilliant way of helping the body heal itself.
So, from stabilizing the patient to clearing out the poison and deploying these incredibly smart antidotes, managing a poisoning is a frantic race against time. It's just a remarkable story of how medicine fights back against a chemical invasion. And it leaves us with one last big question. In a world where chemistry is always evolving, will this high-stakes race between new poisons and new antidotes ever really be over?